Less than 24 hours after the country of Belize went into a 30-day period of lockdown in a bid to halt the spread of COVID-19, a fourth case has been confirmed. The result is from a battery of tests that was conducted recently, the latest victim of coronavirus being a resident of San Ignacio town.
The infected person is from the Cayetano district, but up until about 11 days ago had been traveling to and from Belize City where he worked. He is in isolation at the Western Regional Hospital, and the DHS and his team have already commenced their mapping and tracing exercise. Indeed, swabbing of contacts as a prelude to testing has already started, and the exercise includes coverage of the medical professionals involved in the treatment of the patient.
That individual, a senior member of staff at City Hall, works closely with Mayor Bernard Wagner. In the course of his duties, he may have come into physical contact with other employees of the Belize City Council.
I was informed by Dr. Manzanero, and since then we have been doing the necessary work along with him to ensure that we identify all those individuals and staff members that what we considered primary contact, who made contact with the individual, and those are mainly the staff on the third floor, and thereafter we would list the secondary contacts, second floor, and any other contacts he would have made during that time, and we are filling that form as we speak. So by the end of the day, the health authorities will be getting that form with all those names, and thereafter the mapping would start.
The patient is a 55-year-old man whose diagnosis was confirmed shortly after 1 a.m. today. According to Dr. Marvin Manzanero, that person took ill on March 31st, exhibiting symptoms of fever and respiratory distress. The task ahead for the Director of Health Services and his team is for them to plot a chart of everyone who came into reach of this individual.
We are at this point in time conducting a mapping exercise to identify his potential contacts, as he doesn't have any recent travel history and he doesn't seem to have any primary contact who may have traveled out of Belize in the last 14 days. If we are unable to ascertain that he has any contacts that have a travel history, we will have to consider this as a community transmission. That should be determined by the end of today.
At City Hall, this employee's office is adjacent to the mayor's. Today, the corridors on all 3 floors of the municipal building are clear, save for a few persons here and there. While he has not shown any sign of illness, the head of local government told News 5 that he too would be tested for COVID-19.
Well, I'm feeling pretty well. I'm pretty healthy. I have been doing all my physical activities, exercises every day, and that has been from the day the doctor had indicated that the point with his last contact here. I've been feeling pretty well, but again, you could never be certain. And so this afternoon, I'm supposed to go through the testing for the COVID-19, and I just remain open-minded about it.
This most recent case certainly buttresses government's decision to bring into force a countrywide state of emergency.
It is clear now that the state of emergency declaration and the shuttering of the country came not a moment too soon. Still, there are people insisting that we are overreacting in promoting some of the draconian measures contained in the revised statutory instrument signed last night by His Excellency the Governor General. I hope that this fourth case will help to persuade them of the absolute gravity of the situation.
The seriousness of the present state of affairs may very well reshape government's approach to dealing with COVID-19. That is, after all, confirmations have been made to determine the nature of this case.
If in point of fact it is the first case of a community transmission, then we will have to reclassify and give instructions as to how we will handle the potential cases. We do know that the patient had been seen at a private institution on Sunday and at another private institution on Tuesday, where he was referred for care at the Western Regional Hospital.
Mayor Wagner extends best wishes for the full recovery of his colleague.
It's unfortunate that that occurred with one of our staff members, and we want to wish that staff member well. You could never imagine that the pandemic would be at your footstep, and so we wish him well.
Reporting for News 5, I am Isani Cayetano.